So, can you have a breast reduction while you're awake? I get asked this question all the time. And the simple answer is absolutely yes. It's not my personal preference though. So a lot of procedures can be done without general anesthesia. So you're awake and chatting with us during the procedure. And in general, we do this by doing a little extra work numbing the area. So if you don't have the help of the anesthesiologist keeping your patient comfortable with general anesthesia, then I need to do a little extra work as the surgeon to numb the area. And usually for surgeons that do this on awake patients, we use a dilute numbing solution called tumescent. And we have to be very careful that when we're doing anesthesia this way that we keep track of how much of that numbing solution you get so that it doesn't become toxic, because the medications that numb the skin are not good at certain levels. So it's important if you're going to do this method that you go to a surgeon that's very familiar with it. Now, with longer surgeries, even if you're numb and you're comfortable, you tend to tire out as a patient. It's not fun to be worked on for many hours. And so larger breast reductions can take several hours in the operating room. So frequently with a surgeon who is doing an awake procedure, we'll have a support staff there to help support you as the patient. So it's important if you're going to consider that you talk to your surgeon and make sure that you have a support staff there as well. I think it's really helpful. And then, like I said, a breast reduction is a more of a lengthy procedure, not only because of the actual breast reduction, but also the incision is quite large and takes some time to close. And so frequently, if you are a patient having a breast reduction, I would ask to see if they have an assistant assisting them closing so that you will have the swiftest surgery possible, which is more comfortable for you. So if you're interested in an awake breast reduction, I would highly recommend you check out the account of my colleague, Dr. Megan Gruber. She is an absolute master at awake surgery, and you'll get a lot of interesting tips and information from her.